Away from political matters, the Pediatric Association of Nigeria says the country is losing its workforce to better organized global settings, leaving the remaining health workers overstretched to the extreme limits. The president of the association, Olufemi Ogunrinde, stated these at the scientific conference of the union, which took place at the International Culture and Event Center, Akure. Ayodeji Muradeyo has details.
Available data show that Nigeria has less than one doctor for 3,000 citizens, where there are 1.5 nurses for 1,000 people. The major challenge facing the country's health system remains shortage of personnel, triggered by mass exodus of health workers abroad.
Thank you very much.
The issue and many more came up for discussion at the annual general meeting and scientific conference of the Pediatric Association of Nigeria in Akure, Ondo State capital. The president of the association, Olufemi Ogunrinde, lamented the shortage of health workers in the country. Ogunrinde added that Nigeria has fared poorly in virtually all indices of health, with specific reference to maternal mortality rate.
We need to lose workforce to apparently better organize global settings, leaving the remaining healthcare workers stretched to extreme limits. I think I would like to salute my colleagues that have remained in this country and also change a bit of narration. I get on hearing the fact that the best brains are being drawn away.
State Governor Rotimi Akeredolu, who was represented by the State Commissioner for Health, Banji Ajaka, said government is doing everything possible to optimize healthcare delivery in the face of various challenges.
The system in Ondo State, just like everywhere in Nigeria, is not immune to the Japa syndrome. We are, however, committed to strategically replace health workers.
Wife of the state governor, Betty Anyanwu Akeredolu, who was honored at the event, commended doctors who have decided to remain in the country. The keynote speaker, Professor Akin Oshimbogun, said for optimum child care to be achieved in the country, critical health issues must be addressed.
Because apparently the best amongst us, they are living in droves.
An ill population leads to poor economic productivity and human deprivation with attendant violence. Ill health is also a factor.
Other speakers also stressed the need for the government to focus more on welfare of health workers towards stemming the Japa syndrome. Ayodeji Muradeyo, TVC News, Akure.